Hi, I'm Michael Rourke. I'm the Division Chair of Nuclear Medicine at the Mayo Clinic in Arizona. I'd like to take this opportunity to provide you with an overview of some of the imaging tests that we can perform in the Nuclear Medicine Division at Mayo Clinic, Arizona, in order to help you and your doctor determine sites of prostate cancer and whether or not that cancer has spread to other parts of the body. This knowledge will be important in determining whether or not you will undergo primary surgery or surgery in combination with other modalities or medication alone. In nuclear medicine, nuclear tracers are developed in order to determine sites of cancer in the body. In order to do this, we typically will take a portion of a molecule that your body normally uses in everyday activity and link it with a small radioactive atom that serves as a tag. Once we inject this into the bloodstream, that molecule goes to the part of the body to which it is typically found. In the case of a bone scan, we use a radioactive tracer that tends to accumulate in areas of bone turnover. If you have a recently diagnosed prostate cancer and you are considered at relatively high risk for a spread of that cancer, one of the nuclear medicine imaging techniques that your doctor may request is that you undergo a nuclear medicine bone scan. In bone scanning, we inject a small amount of a radioactive material which tends to accumulate in the skeleton, particularly in areas where prostate cancer has spread. The nuclear medicine physician will then review the images and determine whether or not there are areas of bone involved with your prostate cancer. This in turn will enable you and your doctor to make the best treatment choice for you. The nuclear medicine bone scan involves injecting a very small amount of a radioactive material into an arm vein. 2 to 3 hours later, in order to allow time for the tracer to accumulate in areas of bone turnover, you will be brought back to the imaging room and the technologist will place you on your back on the imaging table. You will then be scanned for approximately 20 minutes, which will provide the radiologist with a picture of your entire skeleton. We look for areas of increased tracer uptake or hotspots on the bone scan in order to determine whether or not that cancer has spread. Areas that show increased uptake may or may not be due to cancer, and in some cases they can be due to arthritis, fractures, and a variety of other non-cancerous conditions. In order to evaluate these further, you may be asked to undergo further imaging tests after the bone scan in order to clarify whether this represents prostate cancer or not. The amount of radioactivity associated with a bone scan is actually low, and it is lower than that of a CT scan. CT scans are often used as another imaging modality for evaluation of prostate cancer that is considered relatively high risk as well. If you have a previously treated prostate cancer, and based on a rising PSA level, your doctor suspects you may have a recurrence of that cancer, nuclear medicine tests may be requested in order to help further evaluate and detect spread. While bone scanning can be done in this situation and does help in evaluation of the bones, in our practice, we also offer PET-CT imaging with C11 Choline. Choline is an essential nutrient in the body and is incorporated into growing cells, such as those seen in tumors. The normal cells in the body accumulate the choline at lower rates than the prostate cancer cells, particularly in the pelvis, and allow us to identify hotspots which may indicate sites of recurrent prostate cancer. This helps us detect recurrent prostate cancer in the prostate bed, as well as in lymph nodes or bones in the remainder of the body. If you are asked to undergo a choline PET-CT scan, you are injected with a small amount of radioactive material. Very shortly thereafter, within several minutes, you are brought to the imaging room and placed on your back on the scanning table. The technologist then performs a CT scan in order to provide us the appearance of the structures in the body and to help us register any areas that are abnormal on the PET scan and match them up with your anatomic structures. From the patient standpoint, what you will experience is similar to that of a CT scan. Although this scan may take up to 20 minutes, you will usually be done with the entire test in 60 to 90 minutes. The images are then conveyed to the radiologist, who reviews the CT images and the PET images, puts those together, and determines whether or not there are areas at suspicion of recurrent prostate cancer. The C11 Choline tends to accumulate in areas of increased cell turnover, such as those seen in cancers. We use this to determine whether or not prostate cancer has recurred in the pelvis at the original operation site, or whether it has spread to other parts of the body. This enables you and your doctor to construct a treatment plan which is best suited to you. PET MRI is a more recent development, and we are able to perform in our practice C11 Choline PET MRI. The advantages of MRI are its sensitivity and precision in detecting sites of recurrence in the operative bed. The strength of the PET portion of the examination is identifying areas of spread to other parts of the body that may not be included in the MRI field of view. This is valuable information in order to allow you and your doctor to construct the most appropriate treatment plan for you. As in other types of cancer imaging, the nuclear medicine imaging techniques are evolving to meet the needs of patients and bring a more personalized approach to your care. Mayo Clinic is involved in clinical trials to evaluate gallium-68 PSMA. C11 choline involves radioactively labeling, that is, attaching a radioactive atom for the purposes of imaging it to a small molecule of choline, which is an essential nutrient that your body uses. This nutrient tends to accumulate in higher concentration in cancerous tissue in which the cells are rapidly dividing. The radioactive atom permits us to do an imaging test where we're able to identify those sites at which the radioactive tag has been attracted by the molecule that is incorporated into the cell, thereby showing us the location of prostate or other types of cancer cells. PET-CT and PET MRI for evaluation of prostate cancer may or may not be covered by your insurance company, depending upon the indication for the test. PET-CT scanning is not indicated, for instance, in cases of early prostate cancer where the PSA levels are undetectable. In these settings, PET-CT, PET MRI, choline PET don't have as much utility. Typically, nuclear medicine techniques are employed when you are suspected to have either a high-risk prostate cancer at the time of initial diagnosis, where you have a very high PSA, or a high-grade tumor determined by your doctor on biopsy that may put you at increased risk of having metastases in the body. Generally, a PET-CT is only ordered if you have a rising PSA after primary prostate cancer therapy. If you have had previously treated prostate cancer and your PSA levels are either undetectable or stable, PET-CT will probably not help you in determining whether or not there is spread of that cancer. Choline PET-CT and other methods of PET scanning are most effective when the PSA level is rising, particularly in patients with rapidly rising PSA levels. C11 choline PET-CT is not indicated in the setting of initial prostate cancer, although in our practice we have run clinical trials which evaluate patients with high-risk primary prostate cancer. The amount of radiation that you receive during a PET scan is typically on the order of that you would receive during a CT scan. This is well within the understood diagnostic radiation dose limits and is unlikely to cause you any future problems. The small amount of radioactivity is not enough to produce any immediate harm. You should not feel any effects of that radioactivity. Over time, the radioactivity in your body will gradually decay away or be excreted through your urinary tract or GI tract. Nuclear medicine tests are in general very safe. There is an extremely low level of reaction to any of the materials that we use in nuclear medicine. Our injections involve very small quantities of the radioactive material. You should not experience any discomfort during the injection of these materials. None of the materials we use involve iodine or gadolinium, such as are used with CT or MRI scans. Therefore, if you have an allergy to those materials, you don't have an issue with the nuclear medicine test. After the scan, your body will be radioactive, and it'll be important for you to stay well hydrated in order to promote clearance of that radioactive material from your body. The small doses of radioactivity which will be introduced into your body do not pose a significant risk to the general public, and that includes family members, children, and relatives. The amount of radioactivity used in these tests is quite low and does not increase risk of cancer or other illnesses to members of the general public. The small amount of radiation exposure associated with a CT or a PET scan should not significantly increase your risk of developing cancer over your lifetime. In general, you should experience no adverse effects associated with the injection of this radioactive material. If you do experience any effects which may be attributable to the medication, you may wish to discuss this with the technologist, the radiologist, or your doctor. While it is very rare for patients to have a reaction to radioactive material injections, it will be important for you to note any symptoms that you may experience after the scan and report those to either the technologist, the radiologist, or your doctor. Being diagnosed with a primary prostate cancer or a recurrent prostate cancer can be quite frightening. Rest assured that the nuclear medicine physicians and your referring physicians will work together closely in order to develop a personalized imaging and treatment strategy for you. Thank you for visiting the interactive tool for prostate cancer decision-making. Feel free to explore the website for additional help, tools, information in making the best decision for you. Again, my name is Dr. Michael Rourke. I'm a nuclear medicine physician at the Mayo Clinic in Arizona. Thank you.